On behalf of NASH 24 by 7, I welcome you to our public awareness program on current management of MASLD and MASH. NASH 24 by 7 Facebook page always aspires to bring top-notch education and awareness program to serve healthcare professionals, patients, and their families. Today, we have renowned gastroenterologist from Hyderabad, Dr. K.S. Somasekhar Rao. He needs no introduction. However, I would fail my duty if I don't mention that. So, Dr. Somasekhar is a leading gastro in Hyderabad, providing comprehensive and care to many patients for various gastrointestinal and liver conditions. He has experience in building clinical skill set that allows him to deliver patient-centric care. Sir is currently associated with Yashoda Hospital, High Tech City, Hyderabad, as a senior consultant gastroenterologist and hepatologist. He has received a Best Doctor Award in Gastroenterology in South by Times Group in 2021 and Icon in Gastroenterology Award by Times of India in 2022. So, sir, we salute your dedication to spreading awareness related to liver health. And now I would like to invite Dr. Somsekhar to enlighten us on the topic current management of MASL and MASH. Over to you, sir.
Yeah, good evening, everyone, and thank you, Ms. Ketki, for introducing me. See, this is the MASH LD or MASH, or otherwise easily talked as fatty liver disease. So, all of us are aware of this word, fatty liver disease, but what I understand is we don't know the severity of this disease. So, as Global Fatty Liver Day, we want to bring awareness about this silent disease, which is causing lot of problems. So, we will talk about MASLD, MASH, how to diagnose it, how do we manage it, how do we prevent complications from MASH in this talk. So, after the talk, if there are any questions, I am happy to answer. Let us start our talk right now. So, we'll go to the first slide. Current management of MASLD and MASH. So when we are talking about MASLD or any disease to the liver, first let us know why liver is very important. Liver is the second largest organ of human body after skin, and it weighs around 1500 to 1600 grams. And normally only 5% of it is fat. It is located in the right upper part of your abdominal cavity, and it is connected to the intestines with a bile duct. So where the bile is secreted in the liver and it passes into the intestine. It's a pinkish brown in color, which is very soft or sponge-like consistency, and it has high vascularity. So what are the functions of liver? Actually, liver has around 600 functions. Around 600 functions are done by liver, and most of them, all of us know about it helps in digestion. It helps in breakdown of alcohol and medications which are consumed by us. It controls, as I told you, around 500 metabolic processes. It produces proteins and cholesterol. It produces bile, which helps in digestion. It regulates blood composition. It processes all our nutrients. Whatever we eat from the intestine, they are absorbed and directly they go into the liver and it is processed there. It destroys old RBCs and it detoxifies our blood. These are the major functions. There are multiple other functions like it helps in gluconeogenesis. It helps in regulating blood sugars, your fats in the body, multiple other functions. Next slide. So when we talked about the liver, let us know about this MASLD. Why is this called MASLD? So previously we were talking and labeling it as just fatty liver disease. And here we are talking about a specific entity where metabolic dysfunction associated fatty liver disease or MASLD. It's a condition in which fat makes up to or more than 5% of your weight of the liver, and it is not caused by alcohol use at all. So when we are talking about MASLD, the fatty liver here is not because of alcohol. And MASLD, if it is left untreated, it can progress to a condition called MASH. MASH is metabolic dysfunction associated steatohepatitis. That means each and every cell of your liver is swollen in this condition. And this can, over a period of time, progress into complete damage of liver or cirrhosis. And what are the risk factors? Being overweight or obese, having type 2 diabetes for a prolonged period of time, or uncontrolled diabetes. If someone has high cholesterol, all these are increased risk factors for MASLD. So, what is the prevalence of MASLD? 1 out of every 4 people have MASLD regardless of weight. And remember, in India, it is not just the weight, it is the abdominal obesity, which is causing more of MASH or MASLD. More than 6 diabetics and 9 severely obese people out of 10 have MASLD. Male gender is more prone for MASH and fibrosis of liver. So this is how a healthy liver progresses to cirrhosis of liver. So healthy liver, after when there is more and more accumulation of fat, we are talking here more than 5% of the liver weight if it is with fat, we call it as fatty liver. Fatty liver, there is deposition of fat and it causes little enlargement of liver, but this fat is not causing any compression to your liver. Over a period of time, this fatty liver, the fat which is deposited on the liver starts compressing onto the healthy liver cells and it causes something called MASH. I was actually talking metabolic syndrome associated steatohepatitis. This steatohepatitis is nothing but each and every cell of your liver is inflamed or swollen. And over a period of time, if this inflammation goes on, these patients progress to something called fibrosis. The fibrosis is nothing but scarring of your liver tissue because of recurrent inflammation. Or and again, if there is an injury and recovery anywhere in your body, there will be scarring. Like on your skin, you may have fissure formation. Similarly, in the liver, you see something called fibrosis. This fibrosis, also, if left untreated, this will ultimately progress into a condition or an irreversible condition of the liver called cirrhosis of liver, where there is extensive scar tissue which destroys the normal liver cells and the functionality or the work which liver has to be done is completely down. This cirrhosis of liver is a risk factor for multiple things. This can progress to end stage liver disease or decompensated liver disease, or it can cause hepatocellular carcinoma or cancer in the liver. So all these things are just because we are not treating our liver at an early stage. Next slide, please. So we are talking about what is the difference between MASLD and MASH. So I was actually discussing MASLD is an initial stage where there is fat accumulation in the liver. It is otherwise called just a steatosis. Steatosis, over a period of time, as the amount of fat increases, this can lead to inflammation of the liver cells. And this is called metabolic dysfunction associated steatohepatitis. So over a period of time, this progresses to scarring of the liver, which is initially a benign stage. It is known as fibrosis. So if we can identify our patients or any of the patients in any of these stages, we will still be able to reverse the progression of disease and we will be able to save our liver. Next slide, please. So what are the causes of MASLD? We were already discussing obesity, uncontrolled diabetes, genetic background also will be there definitely, excessive amount of fatty food, sugars in our diet, physical inactivity, And some types of medications also can cause MASLD, and associated metabolic syndrome are all the cause for MASLD. So obesity and fatty liver disease, they are well connected. Being overweight or obese causes fat to accumulate in the liver, and obesity increases the amount of fat to constitute 5 to 10%. This leads to MASH and scarring of the liver. So as we discussed, a lot of obese patients are prone to MASH. And the association between MASLD and diabetes. There is a threefold increased risk of death due to cirrhosis in patients with MASLD and diabetes. So diabetes increases the risk of MASH, and MASLD increases if there is high prevalence of diabetes in MASLD patients. There is 2 to 4-fold increased risk of developing diabetes in patients who have just MASLD at an initial stage. So they are interconnected. People with diabetes are prone for MASLD. People who are have MASLD are prone, or high prevalence of diabetes is there in them. Next slide. So what are the symptoms? See, most of the time, MASLD or MASH will have very vague symptoms. All of them may not have these symptoms like what I am mentioning here, but these vague symptoms can be, there will be extreme fatigue, easy tiredness. We can see some other signs like enlarged spleen, weight loss, enlarged blood vessels can be seen. There can be red palms. There can be confusion and unable to concentrate. Patients may sometimes present with jaundice. There will be loss of appetite, nausea, and sometimes there will be abdominal pain, mostly in the right upper quadrant. But all these patients who have MASH may not have all these symptoms, but most of the time they are vague symptoms what we see. So how do we diagnose MASLD? Fatty liver can be a silent killer because the progression of disease is very gradual. Very important thing here is, unless we go for a test, most of the time we will be missing this fatty liver disease because the symptoms are always vague. The diagnosis of MASLD often involves blood tests. It can be an ultrasound or a fibroscan. Sometimes we do something called liver biopsy, and there can be sometimes CT and MRI also. Most common blood tests which are associated with MASLD, where we know, is SGPT, SGOT in the liver function test. Persistently elevated SGPT or ALT can be associated with disease progression. This is very important, what all of us should know. Patients who have fatty liver on an ultrasound detected somewhere, immediately they have to get something called liver function test. In that, this parameter, SGPT or ALT, plays a very important role. Patients with normal ALT can also have progressive liver disease, but 80% of patients with MASLD can have normal ALT also. Remember this. There are other parameters also very important, but ALT, when it is elevated, it is very dangerous. There is no designated ALT cutoff for prediction of MASH or advanced fibrosis in MASLD patients. Next slide, please. So there are various other scores. Just with SGPT, we may not be able to diagnose MASH or MASLD. So we have multiple other scoring systems like FIB4 scoring, uh, MASLD fibrosis score, where we use multiple parameters like blood tests, age into consideration, and then we calculate this. These scoring methods have been established to diagnose more better than just ALT and ALT alone. And there are a lot of online tools which are available to calculate these scores. You can enter the values from your blood reports and generate the score to understand the risk of MASLD. So I think this slide is useful for everybody. Everyone can use this. See, most of us, we are getting our own liver tests or blood tests, health checks. From that health check, whether you are at risk for MASLD, you can directly calculate and then go for a consultation. Next slide, please. Non-invasive diagnosis. So ultrasound has been the most important non-invasive test for diagnosing fatty liver disease. And all of us know at this point of time, most of the ultrasounds which are done for other causes, they detect fatty liver disease. And advantages of ultrasound, most important is easily available. It is economic, and it's a reason for most accidental diagnosis of MASLD, as I was mentioning. Downside of this is it only detects if the fat is more than 25%. And in patients who have fibrosis underlying, or when there is fat and underlying fibrosis, it cannot differentiate between just fat and fibrosis. This is the downside of just ultrasound. In these cases, next slide please. We use other methods to diagnose this fibrosis. Non-invasive diagnosis for MASLD, we call it as fibroscan. The advantages are it can diagnose MASLD with fat quantification. Just if the fat is more than 10%, we are able to diagnose that. We will be able to differentiate between fibrosis and fat content, which is not done by an ultrasound, and it is very easy to operate. And downside here is sometimes in very obese patients, interpretation can be very, very difficult, or misinterpretation can be done. This is the downside. So when we are talking about fibroscan, it works on a principle of transient elastography. We get two different values from this test. One is median cap, which is controlled attenuation parameter, which indicates the amount of fat on the liver. The second one is LSM or KPA, liver stiffness measurement, which indicates the degree of fibrosis or stiffness in the liver. So two values which are very, very useful for us, and we will be able to assess the severity of fatty liver disease and severity of fibrosis in the underlying liver. Other non-invasive tests, there are MRI, uh, which is another gold standard for detection of fat content. It can measure fat if the content is more than 1% also. So in patients with who are planning for liver transplantation and donating their liver, this is widely accepted technique for liver donor patients to assess the amount of fat. So in a donor, generally when we do liver transplantation, we don't accept someone who has fatty liver or more than 10% of fat as a donor. So this is how we assess the amount of fat. Next slide, please. Yeah. Liver biopsy. Previously, to make a diagnosis, we didn't have all these measurements of fibrosis, fibroscan or MRIs. So at that point of time, for every patient, for a diagnosis also, we used to do liver biopsy. It is even today, it is a gold standard method for diagnosing MASLD, but used very rarely. And only method previously was diagnosis of MASH was only liver biopsy. Even today, that is the only method to make a 100% diagnosis. But with all these parameters now available, we are reserving liver biopsy in only few patients where we have doubts, multiple doubts in lean patients, non-diabetic patients, in someone who has good cholesterol and all those things. Still, if they have uh, MASH, we call this as lean MASH. So in those people only we are using liver biopsy at this point of time. Only downside of this is there are it's a painful procedure, one prick, but more than pain, one in 10,000 liver biopsies, there can be a risk of bleeding also. So that's why we reserve this for few cases where it is really indicated. Next slide, please. Yes. So remember one thing, progression of MASLD can take years, but we have lot of time where we can do early intervention and stop the progression of disease and avoid all these complications. So when we are talking about progression, so MASLD 20 to 25% progress to MASH or steatohepatitis, which I was talking. Steatohepatitis over 10 to 12 years or sometimes 18 years, which can progress to cirrhosis of liver And once there is cirrhosis of liver, they can develop something called HCC or hepatocellular carcinoma, liver cancer. They can go into progression to decompensation of liver disease, where the treatment option would be only a liver transplantation. So 70 to 75% they progress to isolated fatty liver and fatty liver with mild inflammation. These people may not have progression to cirrhosis, but 20 to 25 definitely will progress to cirrhosis of liver at some point of time if left untreated, if early intervention is not taken. So act before it's too late. All of you please remember, metabolic dysfunction associated steatohepatitis is more serious form of MASLD in which you have scarring of liver and it can lead to cirrhosis or liver cancer. And once someone has a severe MASH or severe fibrosis, it becomes irreversible. So act when it is reversible. Yes, this is the most important thing. What are the treatment options? As on today, the first three things are very, very important. There are newer medications definitely available, but that will come in the last. Most important is diet, dietary modification, exercise, and other lifestyle modifications like avoiding alcohol. There are medications now which are available, and we don't treat everybody with these medications. There are specific indications for giving these medicines. So let us talk about each and everything one by one. Next slide. So most important here is your combination of a hypocaloric diet. Calories should be less and moderate intensity exercise provides the best likelihood of sustained weight loss. You need to lose your weight. Weight loss of at least 3 to 5% of body weight helps to improve steatosis. This definitely helps. Weight loss of 7 to 10% will improve majority of histological features of MASH, including fibrosis. So fibrosis also will reverse. So weight loss effect on MASLD, it's a very simple thing. Weight loss of more than 3%, weight loss of more than 5%, weight loss of more than 7%, or more than 10%. So these things, if you lose at least 3%, there is reversal of steatosis. If you lose around 5%, the inflammation will resolve. And if you lose around 7% of your body weight, NASH or steatohepatitis will resolve. And even fibrosis resolves if you lose around or greater than 10% of your weight. Health. So, what are all the diets what we suggest? So, most important, remember this. This is a suggestion, a Mediterranean diet, which includes moderate portions of poultry, eggs, cheese, and yogurt. All these things are good protein. Every day there should be a meal around vegetables, fruits, whole wheat grains, olive oil, beans, nuts, legumes, and seeds, and herbs and spices can be included. Very less should be red meat and sweets, and often you can use a weak fish or seafood also. Types of exercises, you need to do both aerobic and resistance exercises. Aerobic exercises are your cardio. You can do a treadmill, you can do skipping, you can do your jogging or swimming. This will reduce liver fat, it maintains healthy weight, and improves your cardiovascular conditioning also. Resistance exercises are small amount of weightlifting, and this will reduce your liver inflammation. It improves your glucose absorption and insulin sensitivity. It also improves metabolic parameters with less energy consumption. So fatty liver can improve and become normal liver if you do these things. So other lifestyle tips to tackle MASLD: develop an exercise routine and stick to it, get enough sleep, get enough vitamins and minerals, regular health checks, eat small frequent meals, and lower your sugar intake. This is very, very important. So pharmacological approach, and we have Indian National Association for Study of Liver Diseases, and there are three molecules which are recommended for treatment of NASH or reversal of fibrosis also. Pioglitazone for 2 years, Saraglitazar for 1 year, and vitamin E for 2 years. And in pioglitazone, NASH with or without fibrosis in both diabetic and non-diabetic patients. In Saraglitazar, NASH with or without fibrosis in both diabetics and non-diabetic patients. Vitamin D, vitamin E. It is also recommended in NASH with or without fibrosis in non-diabetic adults and pediatric patients also. Tips to prevent fatty liver: limit your intake of saturated fats and trans fats. Let me be very clear, all your packed foods, all your outside foods will have super saturated fats and trans fats. Please avoid them. Eat a balanced diet. Most importantly, include more of fruits, more fresh vegetables. There is no need of any other detox except your diet. Your diet definitely keeps you healthy. Limit the consumption of refined carbohydrates. Most of it are your sugars and bread. All these things you need to limit them. Maintain a healthy weight. Quit smoking. Limit or avoid alcohol. Exercise regularly. And whenever prescribed, please take your medications regularly. Let's not be silent anymore about this silent disease. Thank you very much. Yeah, I'm ready to answer
Yes.
any of your questions.
So thank you, sir, for this wonderful talk. This has enlightened us. Now, sir, we will take questions from our audience with your permission.
Yes,
Sir,
ma'am.
the first question is MASH be age specific?
See, there is no age specificity for MASH. We are seeing a lot of children also with MASH, metabolic syndrome associated liver dysfunction associated liver disease. We are seeing as early as 4 to 5 years of age. So all these things are budding up most of the time because of the diet. So it
Okay.
is not age specific. As the age increases in men, the risk is more, but you can see it in any age and any gender.
Yes. Okay. And sir, which type of food to avoid in MASH?
Most important, I will keep it simple again. Avoid deep fried oily foods. Avoid all your outside foods, and please avoid these packed foods. Even your biscuits, which are packed, they have a lot of salt, and please avoid those things. Uh, Most importantly, avoid or restrict your sugar intake. Any sweets, sugar, please avoid them. All these things, once you take into your intestine, once they go into the intestine, they become free fatty acids and directly go and deposit on the liver and increase the amount of fat on the liver. So avoid these things, increase the amount of fresh fruits and vegetables. Reversal of fatty liver is possible.
Yes. And what is the recommendation for exercise in MASH?
Most importantly, as I mentioned, you need to do both aerobic and resistant training. Aerobic exercises are at least 45 minutes of brisk walking, cycling, swimming, or jogging. You can do skipping also. These are aerobic. And resistance training is you can do just stretching and start with small amount of weights. You can start with 1 kg weights, but you need to uh, do each and every muscle of your body. This will decrease the insulin resistance and help in mobilizing the fat out of the liver. So it
Okay.
should be always a combination, not just one.
Okay, sir. So now, on behalf of NASH 24 by 7, I extend my sincere thanks to Dr. Somasekhar for his enlightening and engaging talk on MASL. Sir's insight have highlighted the critical need for increasing awareness about fatty liver disease. I also want to express my sincere thanks to audience for their active participation and valuable contribution. Stay connected with NASH 24 by 7 on Facebook page and take care of yourself and your family members. Thank you. Thank you so much, sir, for your valuable time.
Thank you.